Pregnancy is often described as a journey of hope. For many women, it begins with the dream of new life, carrying a child close to the heart and holding on to the promise of a future filled with joy. The image of a mother's hand resting gently on her belly captures that moment of expectation when love begins long before birth. From the earliest stages, an embryo begins to form. At just a few weeks, tiny changes inside the womb determine whether the pregnancy will thrive. It is a fragile time when growth depends on perfect coordination. The beauty of these early stages of life is also a reminder of how delicate they truly are. At the core of development are chromosomes, the strands of DNA that carry the instructions of life. When they form correctly, they guide healthy growth. But when errors occur, the embryo may not survive. Chromosomal abnormalities are the most common cause of miscarriage, accounting for many early losses. In other cases, the problem lies in the blood itself. Conditions like antiphospholipid syndrome can cause blood clots inside the mother's vessels. These clots may look small, but their impact is devastating, blocking the flow of oxygen and nutrients to the placenta. Without that lifeline, pregnancy cannot continue. Sometimes these clots grow large, filling vessels and cutting off circulation. For mothers who experience recurrent miscarriages, doctors often investigate blood clotting disorders as a leading cause. Even elongated clots, stretching inside arteries, can interfere with implantation and growth. This silent problem often remains hidden until testing reveals the cause of repeated losses. Through it all, doctors walk beside families. With compassion they explain, test, and guide, helping parents understand that miscarriage is not their fault. Medical science seeks answers, but emotional support is just as important. Hormonal imbalances can also contribute, disturbing the body's ability to sustain pregnancy. Hormones are the body's messengers, and when they are disrupted, pregnancy may end too soon. Chronic conditions like diabetes and thyroid disease also play a role. Uncontrolled, they create environments where the embryo struggles to survive. Monitoring blood sugar and thyroid levels becomes essential for women trying to conceive. The structure of the uterus itself may cause problems. A healthy womb is designed to carry life, but fibroids or a septum can interfere, preventing growth. Infections, too, can interrupt pregnancy, while the immune system sometimes mistakenly attacks what it should protect. Couples experiencing miscarriage face not only medical explanations, but also deep grief. A couple holding hands in sorrow reflects the invisible weight of loss. Statistics remind us of the scale. 1 in 4 known pregnancies ends in miscarriage. Behind that number are countless stories of pain, silence, and unanswered questions. For many women, miscarriage feels isolating. Sitting quietly by a window, they carry grief in solitude, wondering why this happened to them. But medical care offers answers. Ultrasound scans give insight into growth and health, showing whether a pregnancy is progressing as it should. Some women discover conditions like fibroids or uterine septum, structural issues that can be corrected. Others learn they have polycystic ovary syndrome, a common cause of hormonal imbalance that can make pregnancy more difficult. Lifestyle factors also matter. Smoking, alcohol, and obesity increase the risk, but with support, these risks can be reduced. Treatment may include medication, restoring balance and offering new hope for the future. Support groups provide healing, where families can share stories and realize they are not alone. Symbols of hope carry families forward. A pair of baby shoes and an ultrasound image in hand reflect dreams that still live on. The joy of a positive pregnancy test brings renewed faith, a sign that the journey can begin again. And for many, that journey ends with the joy of holding a healthy baby. The smiles of new parents remind us that hope after loss is real. But healing is not only physical. Therapy sessions, counseling, and compassion help families process grief and rebuild strength. For some, remembrance brings peace. Lighting a candle honors the little lives that were lost, while affirming that love remains. Miscarriage is a painful chapter, but it does not have to be the end of the story. With medical care, emotional support, and unshaken hope, families continue on, and for many, brighter days follow.